Hello everyone, thank you so much for joining us for this edition of Talkin Kids Health. I'm Beatriz Canals. Joining me today is Dr. Vanessa Guerra. Thank you for joining us, Doctor. She is a pediatrician with Nicholas Children's Urgent Care Centers. And we're here to talk about such an important topic because it is affecting so many kids and adults alike, and that is the awful flu that it appears so many people are coming down with. Is it so? Is this the season for the flu here in South Florida?
Yeah, so generally the flu is actually active all year round. We tend to see it start up around October and ends a little bit towards the end of May. But the peak season is December, January, and February. So we're kind of still there. According to the last post from the CDC, it's still pretty active and remains relatively elevated. So we are still in flu season.
On a personal level, do you yourself see a lot of kids coming into urgent care?
Absolutely. So I would say a good chunk of our visits tend to be because parents are concerned their child has the flu, or they've had the flu and they're still concerned that they may have a complication of the flu. So yes, I would say a good portion of our visits are still related to the flu.
When it comes to the flu and adults, we suffer from it just like children do. So often it seems that the symptoms mimic that of a cold, or for example, just a week ago I was diagnosed with a sinus infection, but they tested me for the flu at urgent care just in case. So for parents out there, what are the signs they need to look for that may be of concern that their child may have the actual flu?
So generally, I get this question a lot from parents actually. Does my kid just have a common cold or do they have the flu? And kind of my spiel, what I usually tell them is, the common cold is that you get runny nose, congestion, a little bit of coughing, maybe a little bit of fever in the beginning, but overall, it's doable, it's manageable. The flu, on the other hand, is pretty intense. It's full body, fevers, body aches, headaches, sore throat, coughing, and of course your typical congestion and coughing. So, and generally the difference between a cold and a flu is your cold symptoms may last a couple days, where the flu will kind of put you out for a week or two, and generally the flu will come on pretty suddenly, pretty intense right away. So those are kind of the two main differences between the two.
So if parents see the symptoms, does it make a difference to react immediately? Should they immediately go see their pediatrician or go to urgent care?
So it depends. Those that have significant medical issues, diabetes, asthma, heart problems, they should seek care promptly because those are the ones that would benefit from the antiviral medications that we have for the flu. And typically, if that medication is started within the first 24 to 48 hours, it's when it does the most effect. So instead of the illness being drawn out, it'll shave off a couple of days of the illness. Instead of those severe symptoms and the high fevers, it'll make the symptoms a little more manageable. So starting the medicine is fairly time sensitive because we do want it started within the first 24 hours. But generally, the flu is just a virus like any other virus. We, for the most part, if we're healthy, can do just fine with care at home and rest and hydration. But it is those that have other health issues that we urge to see healthcare quickly.
Because they can become complicated if it isn't treated, correct?
Absolutely, yes. Those that we see with complications tend to be those, particularly in children with asthma and heart problems. Those are the ones that tend to have the complications, such as pneumonias and sinusitis and ear infections. So those we definitely like to see sooner than later.
When it comes to prevention, we try so hard not to catch the flu. What can parents do? What can they do concerning their kids and themselves to avoid from getting or spreading?
So generally, the best way to prevent the flu is the flu vaccine. I myself have it, my children have it, my whole family has it. So that is the single best way of preventing the flu. Proper hand washing, covering your mouth and nose when you're coughing and sneezing. Just general hygiene is the best way to prevent the flu. Those that are in daycares and schools, we urge them to disinfect as much as they possibly can because where there's mass in numbers, they tend to get sick and spread it. So we also encourage them to disinfect as much as possible.
If a child is diagnosed with the flu and they're treated and they're feeling better, how soon can they go back to school? Are there precautions they should take? I know as a parent, we get so upset sometimes when we see that kids go back to school and they're really not ready to, and unfortunately that too can spread the flu. So as a message to parents, what should they do to try to prevent this from happening?
So
they can help each other.
Yes, the issue arises occasionally when we have working families that unfortunately don't have care for their children and would like to send them as soon as possible. But in those cases, we urge them to please keep them home. We ask that at least 24 hours of no fever. Despite any medication, so off all medications, no fever for 24 hours is the earliest actually that we would have the parents send them home. If you can keep them a little longer, that would be even better. the flu virus tends to still linger around despite not having fever. So.
Now, when it comes to the vaccine, you mentioned the vaccine. So often, for years, I've heard people who say, I had the vaccine and so I did not get the flu. Others who say, I swear I had the vaccine and within a few days I was so sick, I've never been so sick. Is that true, that you can actually become ill because of it?
So no, generally the reactions that you get from the flu vaccine are tend to be local. So redness at the injection site, some swelling and discomfort. Just like any vaccine, you can get a little bit of not feeling well, a little fatigue, maybe a slight fever, like we do with most vaccines. But generally, the vaccine is very safe. There's a couple reasons why parents will say, I got the flu vaccine and I still got the flu. Well, the flu is not the only virus that circulates around there during this time. During this winter, fall season, there's several viruses that cause respiratory symptoms just like the flu, so it could very well be one of those. The second reason is that there's several strains of the flu. So the flu vaccine that comes out annually protects us against the most common flu vaccines that there are out there. So there is a chance that you maybe didn't get that. You didn't get coverage from that strain and you got a different strain. The flu vaccine does take about 2 weeks for it to take effect and to work. So during that small interval, there is a possibility that you did get exposed to the flu and got the flu regardless. So to answer your question, no, the flu vaccine doesn't give you the flu, although there are several reasons why you can either get the flu or have flu-like symptoms.
Your opinion, your professional opinion, you would advise
Absolutely.
your patients to get the vaccine?
Absolutely. I recommend the flu vaccine annually. Just because you got one last year doesn't necessarily mean you're protected this year.
Oh, okay.
And then also your immunity will wane after a while. So just because you did get the flu vaccine, it's very well you could already be losing the immunity to it. So we recommend it every year. I myself get it every year. I give it to my family every year. Even anyone who takes care of my children has the flu vaccine.
So any advice for anyone who's watching us now because they happen to have time because they're stuck in bed with the flu, aside from the medication that they've hopefully been given, any advice, things they can do at home to help them get well sooner?
So, the most important thing is rest. We strongly disencourage anyone with a fever, anyone that doesn't feel well, being out and about, and in the sun especially. Fever with superimposed heat from the sun is a terrible combination. So a lot of resting. Whatever anti-fever medicine that you may have at home to reduce the fever, make you feel better. A lot of hydration, because the fevers and the sweating, you do lose hydration that way, so we encourage people to drink as well. And then overall, just relax until you get better.
And in my grandmother's words, sopa de pollo, a little chicken soup can't hurt.
Never hurt.
Doctor, anything else you want to add for parents who are watching us right now when it comes to the flu? Any advice?
My biggest advice would be trust your gut and your instinct. If you feel that your child is not getting better after several days, whether they're taking the antivirus medicine or not, if you feel your child is not getting better, seek care. We have urgent cares throughout, and so we're always ready to see anyone. And especially if your child has gotten better and seems to all of a sudden gotten worse again, that's also a time to be seen because you could have gotten one of those complications that we spoke about. So that would be my biggest advice.
Doctor, thank you so much as always for joining us.
Thank you
we
for
love having
me.
you here on Talkin Kids Health. And if you'd like more information or if you want to leave us any comments, please be sure to visit our website at nicholaschildrens.org/flu. We hope to see you again next time on Talkin Kids Health. I'm Beatriz Canals. Stay healthy.